Question 1. Ty wakes up at 8 a.m. in the morning and plays video games for 20 minutes. He eats breakfast and gets on the bus, which takes 45 minutes. He goes to school all day, comes home, and plays more video games for 35 minutes. Dinner and getting ready for bed takes 50 minutes. Then he plays 15 more minutes of video games. What is the total duration of playing video games? On the surface, this is a basic measurement question. And in reality, that's all it is. Basic measurement is not that difficult. So on the BCBA exam, they're going to present things like this with a lot of numbers, a lot of information to try to distract you and to try to throw you off. In this situation, we know it's an easy question. All we're looking for is total duration of playing video games. We know to find a total of a measurement, we just add up all the amounts of the behavior, and that's our total. So let's not get distracted. Let's just pick out each instance of duration of video games and add those up. So Ty wakes up at 8 a.m. He plays video games for 20 minutes. There's our first duration. Our next duration is playing more video games for 35 minutes. So 55 minutes total. And then he plays 15 more minutes of video games at the end of the night, leading us to a total duration of 70. Don't get distracted by the numbers. We need to really understand what the question is asking and attack the question. Don't let the question intimidate us. Don't let the question distract us from what we're really looking for. In this case, all we are concerned about is total duration of playing video games. Everything else is just filler. Which of the following items has no formal similarity but has point-to-point correspondence? This has been coming up a lot recently, the difference between formal similarity and point-to-point correspondence. And I'll admit, this took even me a while to get when I first learned it. Once you understand it, it really makes sense, but it can be hard to grasp exactly what each is and how they relate to each other. So the simple way is formal similarity and point-to-point correspondence really have nothing to do with each other. Consider them separate things. You can have formal similarity and no point-to-point. You can have no point-to-point, no formal similarity. You can have no formal similarity and point-to-point. They don't really affect each other. So you need to know individually which each is. So what is formal similarity? Well, formal similarity is talking about what form is that verbal behavior taken. Is it written? Is it spoken? Is it read? Is it texted, right? That's the form. For instance, if I say something, that's my form. If I say something and you say something, the forms are the same. We have formal similarity. Point-to-point correspondence is now concerned about what is actually being conveyed verbally, right? So if I say dog and you say dog, we have point-to-point correspondence. If I write dog and you say dog, we have point-to-point correspondence because what is being conveyed is identical. In this case, we want the item that has no formal similarity, but has point-to-point correspondence, meaning the way it's presented is going to be different, but what is being presented is going to be the same. So, A, I say dog, you say dog. Is the form the same? Yes. Say and say, how it's being presented is the same. It has formal similarity. B, I write cat, you write cat. Again, is the form the same? Sure is, right? Write and write. It also has point-to-point correspondence because what's being written is also identical. C, I say ball, you write ball. Is the form the same? Well, I say, you write, the form is not the same. So we don't have formal similarity. Do we have point-to-point correspondence? We do. Ball and ball are identical. No formal similarity, but point-to-point correspondence. And D, I write taco and you say soft. No formal similarity, right? Because we are writing and you are saying, but we also don't have point-to-point correspondence. I write taco and you say soft. They're not the same. The only one where we don't have formal similarity, but we do have point-to-point correspondence is C. I say you write ball, ball. Blaine is a nonverbal 5-year-old. He loves apples, so he will hit his mom to obtain an apple. This started when his mom gave him an apple to stop him from hitting, but did not give him an apple after he gave her a picture card. This represents what? Pretty clear behavior question, right? So we want to attack this question, but in this case, what are we looking at? Well, we're looking at the different dimensions of ABA, right? So we're not too concerned about why the apple is reinforcing him and mom differentially reinforcing the wrong thing. We're really worried about what dimension of ABA has this mom represented, or what dimension of ABA does this question represent, right? And in this case, we know Blaine is doing what? Well, his behavior is being reinforced for hitting and not the picture card. So through learning history, Blaine is obtaining an apple through hitting and not actually the way he should be, a picture card. Now, does this represent parsimony? What is parsimony? Parsimony says the simplest explanation. We're not really looking for a simplest explanation here, right? This is pretty much focused on Blaine's behavior and being picked one way or another. We're talking about selectionism, meaning behavior is chosen. So if we have phylogenetic, right, that would be genetic and inherited. If we have ontogenic, which we're talking about here, behavior is selected through learning history. So through Blaine's learning history, he has learned that if he hits mom, he gets an apple, but the picture card doesn't produce an apple. In the future, what is Blaine going to do? Hit mom. Not generalization, because there's no indication that generalization is occurring in this situation. And it's not technological, because we're not actually looking at trying to duplicate this intervention. We're talking about learning history. We're talking about selectionism. We're talking about Blaine's behavior being chosen and being selected based on the environment and based on learning. This scenario represents selectionism. These type of questions are difficult. You really need to understand what is the question most trying to get you to identify, because so many of these are so similar, right? You have to be very careful. You have to read very careful. We don't talk about a simplest explanation. We don't talk about generalization, and we don't talk about replicating anything. The most clear and only thing we can pick is selectionism. Blaine's behavior is being chosen based on learning history. Lane conducts an assessment and selects a client's hand flapping as a target behavior. She has two interventions she wants to use. On Monday, she uses intervention A. Then on Tuesday, she uses intervention B. She rotates this way for a week and a half. What type of design is this? If you know experimental design, this should be pretty straightforward, right? Think about this if we graphed it. So on Monday, we have intervention A. We'd record the behavior, how it looked. B, on our Tuesday, we have intervention B. We record the behavior. So if you can start picturing our line graph, what are we doing? We're bouncing back and forth from A to B, A to B, A to B, A to B, right? Well, are we alternating these treatments? We are. Alternating treatment, I think, is the easiest, right? And reversal is pretty easy too. When it comes down to it, experimental design is not too difficult once you get a hang of it, right? It's pretty clear what we're doing here, okay? She has two interventions. She doesn't know which one to use, so she's going to alternate and rotate back and forth for a week and a half. It's not a reversal design. Be careful, okay? We never go back to baseline here. We don't even say we have baseline, right? So be careful there. If we don't go back to baseline, we're not reversing it. It's not multiple baseline, okay, because we're not going across multiple settings, people, or behaviors, right? We're using different interventions. And then we're not doing a changing criterion, because changing criterion targets one behavior for increase or decrease, and we slowly change that criterion. Instead, we have multiple interventions that we're rotating back and forth. We're talking about a multi-element design, also known as an alternating treatment design. The key giveaway is you have two interventions she wants to use, and she's rotating these interventions with each other. If this had said on Monday she uses intervention A, then she goes back to baseline, then she goes to intervention B, back to baseline. Now we're talking about a reversal. But since we're not going back, there's no baseline, there's no withdrawal, reversal to baseline. We're talking about an alternating treatment or a multi-element design. Which of the following is not a key component of stimulus equivalence? Stimulus equivalence, easier than you think. Three primary things we're looking for in stimulus equivalence: reflexivity, symmetry, transitivity. So we can eliminate A, right? Symmetry is a key component. What are we trying to establish with stimulus equivalence? Well, typically we're going to see, can you match A to A? Can you match A to B, which is going to be equal to A? So we're going to match the sample. which is C. So we can eliminate C. Now, this idea of derived behaviors. What is derived behaviors? Derived behaviors is an unlearned behavior. So if I have reflexivity and then I get to symmetry, I'm trying to see if I can get A to equal C without actually teaching it. That's the entire idea behind stimulus equivalence. If I'm explicitly teaching A equals C, or transitivity, it's not technically stimulus equivalence. Stimulus equivalence are talking about derived behaviors. We're deriving it from reflexivity and symmetry. All three of these are actually key components of a stimulus equivalence. Symmetry along with reflexivity and transitivity, derived unlearned behaviors, and then matching to sample is the best way to check for stimulus equivalence. So which of the following is not a key component? D, none of the above. Hopefully you read all of your answer choices like we talk about, and this is a good reason why, because you never know what the answer choices are going to hold, right? All three of these are a key component. D is the only answer we can pick. I played golf by myself today. After hitting my third bad shot in a row, I slammed the club to the ground. Later on in the round, I hit a bad shot and I slammed the club to the ground. Slamming the club is reinforced by what? We're looking for the maintaining consequence of slamming the club. Well, let's find our antecedent, right? Well, hit a bad shot, slam the club, hit the ground. Hit a bad shot, slam the club, hit the ground. So slamming the club is most likely reinforced by hitting the ground. Now, is that reinforcement? Well, of course, right? We have reinforcement, the behavior continues, so we know it's reinforcement. This question wants to know, is it socially mediated? Is it automatic? Is it positive? Is it negative? So let's start with socially mediated and automatic. Socially mediated means what? It means there's a learner and another person involved. It's mediated socially. Automatic means alone. Means I don't need anybody socially delivering the consequence. In this case, it's just me. This is automatic reinforcement. I'm by myself. The ground is delivering the reinforcement. Nobody's socially mediating this. So we're looking at automatic reinforcement. So B or D has to be our answer. Now, ask yourself, is it positive or negative? Well, you hit a bad shot, antecedent. You slam the club, behavior. The consequence is you hit the ground. So you can consider it adding the force of the ground, adding the impact of the ground, adding the motion of swinging the club. However you want to look at it, we're adding something. So it's going to be positive reinforcement. Slamming the club is reinforced by automatic, because I'm alone. Positive, I'm adding something. Reinforcement, my behavior is increasing / maintaining. Yesterday, Hillary was driving on the interstate to work. She saw a piece of debris in the road, so she swerved to the right and narrowly avoided hitting the debris. Seeing the piece of debris is the blank for swerving to the right. All right. What is our behavior? What behavior are we looking at? Well, we are looking at swerving to the right in relation to seeing the piece of debris. So let's find that in the question. She saw a piece of debris in the road, so she swerved to the right. Is seeing the debris an antecedent? Well, of course, it comes before the response. So we can eliminate D, a consequence. Now, is it an MO, an SD, or a prompt? Well, a prompt has to follow an SD. And since this behavior occurs right after seeing a piece of debris, we know it's not a prompt. Okay. Driving on the interstate is not the SD, so it can't be a prompt. So it has to be an MO and SD. Well, seeing the piece of debris actually evokes this behavior, right? Hillary doesn't actually swerve until she sees the SD. Okay. When she sees the debris now says, okay, if you swerve, you're going to get negative reinforcement. You avoided the debris. So the debris, seeing the debris evoked, okay, the swerving to the right behavior, making it the SD. SD signals reinforcement is available, right? And it also evokes the behavior. Our answer here is B, SD. After conducting a multiple stimulus preference assessment with replacement, you determine your client loves toy trucks and dinosaurs. For the next 2 weeks, you reward your client with toy trucks or dinosaurs and record if behavior increased. You are conducting a what? Be careful here, right? Pretty easy question, but we want to make sure we understand it. Don't miss the easy questions. First off, what are we looking at? We're looking at the type of assessment we're doing. Okay, we're conducting some sort of assessment. So we know we've already conducted a multiple stimulus preference assessment with replacement. And we determine our client loves toy trucks and dinosaurs. So now we reward our client. And importantly, we record if behavior increased. So what are we checking for? We want to see, do toy trucks, do dinosaurs have any impact on behavior? If they do, what do we consider them? Well, if they increase it, they're going to be reinforcers. So are we conducting preference assessments? No, we've already done that, right? In preference assessment, we're only identifying stimuli. We're not identifying its effect on behavior. Again, B, forced choice preference assessment, not using that. We are conducting a reinforcer assessment. We know the client prefers toy trucks and dinosaurs. Now we need to see, do these actually have any impact at all on the behavior? Preference assessment comes first, identify stimuli, then reinforcer assessment. Are these stimuli reinforcing? Are they not? Of course, it's not an indirect assessment because we're directly observing the behavior. You reward your client with toy trucks or dinosaurs and record if behavior increased. You are conducting a reinforcer assessment. You assign 2 RBTs to record data using the same measurement system on the same behavior so you can check that the treatment is being implemented correctly. The 2 RBTs recording data is considered what? Okay, kind of a funny worded question, kind of a tricky question. So what do? We slow down and ask ourselves, what are we looking at? We're looking at the 2 RBTs recording data. And in the question, it says the 2 RBTs are recording data using the same measurement system on the same behavior so you can check that the treatment is being implemented correctly. So what are you going to do? Well, you're going to take this data and compare it. Is the 2 RBTs recording data treatment fidelity? No, you're checking for treatment fidelity. The RBTs recording the data is not treatment fidelity. You're trying to test for treatment fidelity using IOA, inter-observer agreement. Inter-observer agreement, 2 or more people take data on the same thing, and then we compare that data. That's what we're doing here, right? Trying to determine treatment fidelity. It's also not observer drift or treatment drift. Again, if our data is off, maybe we identify treatment fidelity is low because of some sort of drift, but we're not, the 2 RBTs recording data isn't identifying the drift. We're using the IOA to try to identify fidelity, leading us to question drift. Okay, understand that cycle. If we're comparing data between 2 or more people, it's typically going to be IOA or inter-observer